Good day! In this video, we will be talking about Ascaris lumbricoides. Ascaris lumbricoides is the largest nematode parasitizing the human intestine. It is an intestinal worm found in the small intestine of man. They are more common in children than in adults. As many as 500 to 5,000 adult worms may inhabit a single host. The common name of the parasite is giant intestinal roundworms. Ascariasis is an infection of small intestine caused by Ascaris lumbricoides, which is a species of roundworm. Roundworms are a type of parasitic worm. Infections caused by roundworms are fairly common. Ascariasis is the most common roundworm infection. The human is the intermediate and final host. The adult worm resides in the small intestines, while the larva is in the lung. The ovum is the infective stage. The roundworm Ascaris lumbricoides is the largest intestinal nematode affecting humans, with females averaging 30 cm in length and measuring 3 to 6 mm in diameter. Males are smaller, ranging from 15 to 30 cm in length and 2 to 4 mm in diameter. Live worms appear creamy white to yellow and often translucent with a pinkish tint. The posterior end of the female Ascaris lumbricoides is straight and spicules and papillae are absent. On the other hand, the posterior end of male Ascaris lumbricoides is curved and has two spicules and has many forms of papillae. The geography of Ascaris lumbricoides is worldwide. It has high prevalence in underdeveloped countries that have poor sanitation, like parts of Asia, South America, and Africa. It occurs during rainy months, tropical and subtropical countries. It is elongated, cylindrical, and tapering at both ends. Sexes are separate. The female is longer than male, 20 to 35 cm long and 4 to 6 mm in diameter. Male is smaller, being 15 to 30 cm long and 2 to 4 mm in diameter. The posterior end of male is curved, having pineal setae near the end. The mouth opens at the anterior end. It is surrounded by 3 finely toothed lips. The lips are 1 dorsal and 2 ventrolateral. These lips bear sensory structures called labial papillae. The dorsal lip has 2 double sensory papillae, and ventrolateral lip has 1 double sensory papilla. The ventrolateral lip also bear omphidial gland, which is olfactory and chemoreceptor. The site of inhabitation is small intestine. The infective stage is embryonated eggs. The route of infection is by mouth. No intermediate and reservoir hosts. The lifespan of the adult is about 1 year. Adult worms live in the lumen of small intestine. A female may produce approximately 200,000 eggs per day, which are passed with the feces. Unfertilized eggs may be ingested but are not infective. Fertile eggs embryonate and become infective after 18 days to several weeks. After infective eggs are swallowed, the larvae hatch, invade the intestinal mucosa, carried via the portal, then systematic circulation to the lungs. Larvae mature further in the lungs 10 to 14 days, penetrate the alveolar walls, ascend the bronchial tree to the throat, and are swallowed. Upon reaching the small intestine, they develop into adult worms. Between 2 and 3 months are required from ingestion of the infective eggs to oviposition by the adult female. Adult worms can live 1 to 2 years. First stage arabiliform larvae pass in the feces and develop in the soil into infective stage filariform larvae. These penetrate the skin of humans, enter cutaneous blood vessels, migrate throughout the body, especially to the lungs, and finally mature in the small intestines. Transmission occurs mainly by ingestion of contaminated food or water with eggs, occasionally by inhalation of contaminated dust with eggs. Children playing in contaminated soil may acquire the parasite from their hands. There are two phases in Ascariasis. Number 1 is the blood-lung migration phase of the larvae. During the migration through the lungs, the larvae may cause a pneumonia. The symptoms of the pneumonia are low fever, cough, blood-tinged sputum, and asthma. Large numbers of worms may give rise to allergic symptoms. Eosinophilia is generally present. This clinical manifestation is also called Loeffler's syndrome. Number 2 is the intestinal phase of the adults. The presence of a few adult worms in the lumen of the small intestine usually produces no symptoms but may give rise to vague abdominal pains or intermittent colic, especially in children. A heavy worm burden can result in malnutrition. More serious manifestations have been observed. Wandering adults may block the appendical lumen or the common bile duct and even perforate the intestinal wall. Thus, complications of ascariasis such as intestinal obstruction, appendicitis, biliary ascariasis, perforation of the intestine, cholecystitis, pancreatitis, and peritonitis, etc. may occur, in which biliary ascariasis is the most common complication. Clinical features are abdominal pain, diarrhea, vomiting, and slight temperature. It blocks intestine and appendix. They may enter bile or pancreatic duct and interfere with digestion, injure the intestine, and cause peritonitis. They produce toxins which irritate the mucous membrane of the gut or prevent digestion of protein by host by destroying an enzyme trypsin. In children, they cause stunted growth and makes the mental capacity dull. Larvae causes inflammation and hemorrhage in the lungs, which results in pneumonia and may prove fatal. The diagnosis depends on the identified worms or eggs. there is this stool examination. It is for seeing the adult worm or the egg. The sputum examination is for seeing larvae during migration in the lung. And eosinophilia as indicator on parasitic infection. The symptoms and signs are for reference only. The confirmative diagnosis depends on the recovery and identification of the worm or its egg. The Ascaris pneumonitis examination of sputum for Ascaris larvae is sometimes successful. The intestinal ascariasis, which is feces, are examined for the Ascaris eggs. Keeping good sanitation conditions is the only way to prevent the infection of Ascaris. Pollution of soil with human feces should be avoided. Vegetables should be thoroughly washed in a mild solution of potassium permanganate and properly cooked before use. Fingernails should be regularly cut to avoid the collection of dirt and eggs below them, and hands should be properly washed with some antiseptic soap before touching edibles or eating.